Welcome everyone. This is John and Erick Iams. Today we have a very special guest joining us. It's Dr. Abhishek Sharma. How are you both doing today?
Hello, sir. I'm fine, and thank you for having me here and making me an important member of the PERT family.
Thank you for joining us. Before we get into the announcement, I wanted to give our viewers a little bit more detail on your background. Dr. Sharma, can you share with them?
Sure. So I have a master's degree in neurorehabilitation, and I have been teaching and training undergraduate and postgraduate physiotherapy students since past 15 years. And after I was introduced to PERT, that gave me the confidence to quit my full-time job and to start a private pain clinic. And now I am the most sought after practitioner in my area, and people are always after me what kind of magic I'm doing with my PERT rehab. And all thanks to John sir for introducing this and training so many physios around the world and helping us change their quality of life.
Oh, that's awesome.
That was very special. Thank you.
I would like
How
to add.
did you? Sure, go ahead.
Yeah, I would like to add more about my passion about teaching. So I was so much into making people understand in as simple way as possible that somehow, God willing, I was able to start a YouTube channel called Physio Classroom. So I'm the founder of that, and I'm proud to say that it is being viewed in 20 plus countries, and it has more than 220,000 subscribers. So this has also helped me a lot, the positive pressure, learning new things, sharing it with others. And PERT has helped me again a lot to upgrade my skills. And now I'm here talking to you on this platform, and I'm feeling so good.
How did you initially discover PERT, and what kind of guided you to learn more and continue your journey with us?
Well, I believe that one should always remain a student for life. And like John sir, I have seen thousands of square foot of library in his room. Same way, you know, I always keep looking after new things. So I was studying a book called Gender Approach by Vladimir Gender. And there I got a reference about this primal reflex release technique, and I was having no idea what this is. So I started looking for materials, started hunting, then I reached the website, then I ordered the home study course, started practicing it, and boom, everything just changed. That physios can turn and create results in a single setting. And this was an eye opener for me, and I then this gave me an interest to learn more and more and more. And then life has never been the same. It gives me pleasure, and now the work is it's like time flies.
What kind of, to share with the future students, what kind of results are you seeing when you're using it in your clinic?
Well, the statement that John sir gave in one of his video that struck me the most: feel better in 4 or schedule no more. The kind of confidence that the practitioner gets after practicing PERT, it's not that we have to keep our fingers crossed the next day and hope that the patient will tell us that he is feeling better. It's the same session, same day, maybe within seconds or minutes, and pain is not there. And the patient is like, wow, it was, I'm having this pain since months or years, and what have you done? So, so the thing that I would like to share with my audience, with the audience of PERT, is that if you are not into it, then you are missing a lot.
Yeah, I think at one point we had a conversation, and you mentioned that it kind of puts the power back in your fingertips, like that you're able to make changes with your hands instead of relying on machines and modalities.
Exactly. People are investing lakhs of rupees, on machines, and they're keeping it just to make the patients pain free. But once a practitioner starts learning PERT, he becomes so much aware of what is happening around in the body. The palpatory skills becomes improved, and as well as the areas that we have never looked after, like there are so many areas which we never regularly examine and think of. And PERT gives us a thorough idea of how to examine and treat areas which can, quickly help us in reducing patients' pain. So that's awesome.
Now, it sounds to me like this may be something that you want to keep secret just for yourself and be the only person in India to master this, but you want to share it with others. So why is that important to you?
Well, my motto of life has always been to learn and share. So PERT is now providing me this platform to organize courses and share it with people who want to enroll in the PERT level 1 and up higher programs. So now I'm planning that this extraordinary treatment approach must be available to different practitioners in India and different countries. And this is what I think is the aim and vision of John sir also, that this, the years of hard work, it should keep us giving us good results and be more productive in future, and more physios should join, as well as the other healthcare professionals. And PERT is an evolving approach, and I think a lot of people are going to contribute into it and make John sir feel proud about it.
Yeah, well, we're I know that we're both honored to have you representing us there in your country. And the important announcement for your upcoming program is that we have the level 1 PRRT seminar. It's coming up the end of this month, May 27th and 28th. Do you want to share with the viewers a little information about the location, time, anything else you want to share?
Well, this is going to be the level 1 PERT seminar, and this is going to, introduce the practitioners into how PERT is going to treat, how PERT approach is going to help them treat patients. It is going to be held in Dehradun, and it is being held in the Advanced Neuro Rehabilitation Center, Ananda Hospital. And we are going to examine more than 25 plus areas of the body in level 1 and treat them, and people are going to enjoy, and 2 days are going to pass like, in seconds.
Yeah, and part of the registration fee for the upcoming seminar includes online access to the introductory course. I wanted to be sure that people knew that they have the online virtual attendance option as well if they can't make it in person.
Yes. Yes.
And
I would like to thank Erick sir for that, because this course has been launched at a very reasonable price, and people are not only getting access offline and online to the course, but they are also getting the access to the basic PRRT introductory course, and that will also is going to boost their knowledge about the PERT therapy.
Yeah, we will include a link below the video with all the details and how to register. Dad, I wanted to make sure you got a chance to share anything about how excited you are, and wish Abhishek good luck with his first course. Do you have any thoughts for us?
Yeah, I'm so moved by the fact that we've got him teaching, and the passion that he shares with us about PERT, and the fact that we're talking about something that is just it's so extraordinary to be able to have dramatic changes in the majority of people that we treat using PERT. The expressions that people have oftentimes as a result of the work that we're doing, it's a reaction where they can't almost believe the change that's occurred when they move the part of the body that's been treated, that's been painful for them. The expression that they have is almost a startle response. The startle reflex is the most primitive reflex that we have, And in this case, it's a very powerful positive response to PERT. And this is what I think is the basis to them feeling the passion of sharing the work with other people who may need some help with their pain issues. So that, I think that separates PERT from virtually every other approach that is in the musculoskeletal field. There's a lot of things out there that are helpful, but very few of them, if any, make the impact on the very first session with someone like PERT does. And that's not to say that everyone who has that response to PERT on the first session, that's the only thing that needs to be done for them. But usually, almost always, it's a dramatic improvement, over 50% in one session. And oftentimes there's not a need for more than maybe 1 or 2 other sessions to completely resolve whatever the issue is. And that really then encourages people to share with anyone else that they're talking to that may have an issue with pain. And it may not just be pain, it may be stiffness, aching, tenderness, tightness. There's a lot of other words that describe the symptoms that people may have. And again, what I'm trying to say, though, is that the fact that we can make changes dramatically in most people on the very first visit separates PERT, I think, from everything else that's out there.
Thank you. Yeah, I think should we have it include the warning that their practice may become overrun with patients, Abhishek? You become pretty popular pretty quick, right?
Yes, it has been 2 months only, and I am squeezing time in my appointment diary to fit people in. Okay, you can come this month, this time, yeah.
Well, we sincerely appreciate you squeezing us in to shoot this introductory video for all of our users. So thank you for joining us. Thank you, Dan, for being here. We're very excited for what the future holds for you in India and other parts of the world. So thank you again.
Thank you. Yeah, thank you again. I echo Erick's feelings. Thank you so much.